True. And I also got a safety question. Well, we know that like standard treatment for cancer, like from Western medicine, is maybe like 100 years old. I don't know, chemo and stuff like that. But anyways, is it? You think is it totally okay if people like say? I know we wouldn't recommend it, but from our being not medical doctor. I mean, I'm not medical doctor, and I wouldn't tell anyone to not to receive medical treatment. But if people decide for themselves, what do you think? Is it totally okay if they say, "Well, I'm going to go for some sort of alternative treatment and healing, and screw the medical stuff," to decide to be unchecked by doctors? What do you think?
Well, every decision that we make comes from a choice, and we all have individual free expression of choice. The dogma is that the system influences our thinking, and we're just told what we need to do. But then there are some lateral thinkers that do think outside of the box. I never discourage anybody from experiencing chemotherapy. If that's what their oncologist or that's what their GP thinks is the best course of treatment for them to have, then and they choose to go ahead with that, that's perfect. Let's work with it. Those individuals who choose to primarily seek integrative therapies or alternative therapies, then they're at choice as well. And I entrust that they know what it is that they're doing. Now, if one of those patients came to see me and they asked me my opinion, well, perhaps I'd try to encourage them to become more in touch with their own intelligences inside of them through their thinking brain and their heart brain and their gut brain, and form their decision based around what their system is telling them. However, unfortunately, perhaps some of these people can be influenced by others as well, who may be perhaps against having chemotherapy and radiation therapy, and the individual can be put into a position of doing that without having free choice. I think it's about information and information gathering, and surrounding yourself with a team of experts, no matter what they are. One thing I pride myself on is I know when to refer. I know when I might not be the appropriate person for that patient to be seen. For example, relatively recently, just several months ago, I was working with a patient in a physiotherapy clinic. So I work alongside some Western physiotherapists. And I was working with a lady who had some lower back pain. And we talked earlier when we first began our discussion this evening on the Terry techniques that Dr. Robbins and Jonah have been talking about. And we talked about this iliopsoas muscle problem, and I mentioned to you about this as being one of the major players in lower back pain problems. So I often check it. So I abdominally palpated this patient, and I felt a mass in her abdomen. And I just pointed that out to her. And I asked her if she was aware of that. And she said that she wasn't. And I asked her to go and have that looked at by her doctor, because that's a red flag. Now, I'm not a medical specialist. I just felt something that, to me, wasn't right. So my first instance is to refer that patient to a medical healthcare provider, general practitioner, her family doctor, to have that looked at. Now, as it turned out, that was a lymphoma. And that early detection from myself as an acupuncturist may well have saved that lady's life. I don't know. I haven't seen her again. I only hope things have gone well for her. I hope they got it in time. So an individual who chooses to have chemotherapy or not to have chemotherapy, I think it's an individual's choice, as long as that choice is made with the best intentions behind it, and with the best outcome in mind for that person, whether it's their own decision to do that or outside influence talking them into doing that. So I don't really ever patients do ask me, but I tend to not explore that kind of thing too much. I might refer that person on and have them talk to a medical counsellor, because that's very useful as well. Talk therapy has its place. They do great work, those people, and I have a strong support team of those folks with me, and obviously that's considered mainstream psychotherapy and counselling, medical counselling over us tappers. So it's been a hard road for me, having that accepted by them, and they're slowly coming around. It's still a work in process, because anything emotional is meant to be their department, but we know that there's not a separation between mind and body, and it's enveloping poignantly all of the things that the person is presenting with. So an individual choice based on good information, but that's all it is. It's only ever an opinion. And some of these folks, are left in the wilderness, and we know that we're living in the information age, and they go online and they Google this and they Google that. And there's a wealth of information out there. I think there's a lot of great information. I'm sure there's some misinformation as well. So just look at diet and nutrition. There's so many dietary and nutritional regimes out there that one could take on board, and which one is the right one and which is not the right one. Well, I guess it needs to be tailored individually, Thomas. And that's where I guess some other frameworks come in, because every person is different. So what might be useful for that person might not be for that person. Not one size fits all. Yeah.
Sure. Okay. Well, and when patient really decides to go with surgery and go with chemo and stuff like that, well, from the sources that I heard, the doctors, they little bit make you really believe you are sick, even though I know you are sick when you're not, but the people who really experience this stuff have some certain illness like cancer. They really let them know they are sick, and you were talking about it, that their stuff really is about illness. Their attitude is about illness. So how well, if we can hear it several times a week when we have to go to chemo, or you're sick, you will be sick if you don't do this or you don't do that. We don't know if we can help you anyways, and you can never heal. What should we do if we really want to get out of this negative suggestions? If we want the healing to allow or to happen, or miracles happen every day, but I think we need to allow our mind to heal the body. So how do we get out of those negative suggestions? What would you suppose?
Well, to begin with, I just want to let you know that the medical profession that deliver the content this way are just doing their job. They're bound by their profession to deliver the facts. Okay, so they're just doing their job. They all put their hand and do no harm. So they all have good intentions behind the work that they do. And I just want to make that very clear. It's a part of the work that they have to do. They need to inform the patient. The patient has every right to be informed of what their diagnosis, prognosis, so on and so forth, treatment, therapeutic interventions will be, and what they could expect. And that information is given to them, but perhaps in a way, and Lisa Rankin, a wonderful MD up in the States who has a book called Mind Over Medicine, I think it's called. She has a beautiful symmetry of how this can be integrated and delivered in ways that are so impactful on the patient, because we don't know how impacting that is on the patient. And it's this aspect of it that medical doctors, they simply just don't learn that at school, that this has any effect on us. It's not part of their curriculum. It's not something that they know about. They just look at the body as a machine and it's broken, and they just focus on what it is that they see in relationship to the changes at a cellular level. And they very rarely even see the person because they're so focused on the tumor and what it's doing. So I think it's empowering for the individual to look for complementary therapies, to keep an open mind to perhaps other options, and maybe just to explore. But as I mentioned, there's a lot of information out there, and where does one begin in relationship to exploring options that can help to these people with these beliefs that go in, with these memories that are imprinted neurologically into their systems that start causing them to have a lot of worry and negative self-talk and sub-vocalizations that aren't serving them, that are making them feel the way that they're thinking and constantly triggering that fight or flight response. By simply trusting their intuition. The mere fact that anybody is out there online looking for something that's complementary or integrative to their care, whilst they're experiencing a life-threatening illness, or as they're going through conventional treatment of serious illness, namely cancer, the mere fact that that person is online looking suggests that there's a part of them that has a belief that there's somebody out there that can help them in other ways. Otherwise, they wouldn't be looking. And people find tapping protocols or EFT because it's there's a lot of it on the internet. People are punching in, so on and so forth, and now some of these things are starting to show up on the sides of pages, and people are starting to look at it, so on and so forth. I just feel that it's very important that the person just back off a little bit and get a little bit of a bigger picture before they go diving head first into just the first thing that they find. But to speak to other people, to communicate with other people, to share information with other family members or friends who may have experienced something similar, because a personal recommendation is always going to be something a lot better than we might find on the net. So there is a lot that can be done. And again, the tapping protocols in relationship to going back to the time that we were in the doctor's office, that we were given the diagnosis, we were given the prognosis, it was all laid down on us. We were told that we're going to have this side effect and that side effect, and it's going to be terrible and horrible. I don't think they do that, to be honest with you. But perhaps they may not do that, but that's how the person perceives it. And that's what they take in. So by going back to those specific events and tapping through them and releasing the emotional charge off them and re-imprinting them. I struggle sometimes with the re-imprinting process because, you know, although we know the story is made up, but it's also kind of real too, you know. So you can't kind of tell a person that it's all made up and it's not real, because to them it is. You never say to a cancer patient you know how they feel, because you don't. So So it can be very difficult to maneuver around that, and that takes a lot of tactic and a lot of skill. It's not just a matter of going in and doing, a pick, poke, and provoke technique, for example, on that person, because that's just going to freak them out. Pick, poke, and provoke, that's quite an aggressive technique. It's aimed at amping up the emotions, because the faster we can amp them up, the better we can get rid of them. However, in that approach, I think, you want to kind of do more of the, TLS trauma technique, where you creep up on the issue a little bit. You start tapping around it before you get to it, so that you've already calmed down that, that response before you get anywhere near it with these kinds of people. I think that's useful. So again, collectively, no two people are the same, Thomas. It's fascinating. And as I continue to grow and, learn more and discover more and continue putting myself out there and learning from all of these wonderful people on the net that are making this information available, and, Robert and Eric and Jonah and, Kim and Dave and, all of these awesome practitioners out there bringing this to those people who are looking. Hopefully it'll allow them to be able to get in touch with themselves, and what's best for them will come to them naturally. Whether it's an EFT or a FasterEFT or a metamedicine practitioner or a Psych K practitioner, or many, many different techniques, as we know now, being developed through the energy psychology field. And I don't think that it's about a best way. I never look at any technique as being the way. It's only a way, not the way. There are many ways, many techniques. So many wonderful practitioners out there offering so much care in this field. And I feel very honored to be, at the forefront here in New Zealand in relationship to what I'm doing, because it's exploratory in itself.
Okay, my friend. I guess we went through all of my questions. It's been a great interview. I want to thank you so much for sharing your very valuable information with us and with people around here in my country, because I'm going to have to translate it all, and because we really don't have so much sources like you do, because lots of people here don't speak English. Well, the young ones do, some, but the older people don't really. They look for information, but they cannot find it because it's not really in our language. And that's kind of what I do. I'm trying to help, and you helped me like very much today. And let me thank you from the bottom of my heart. So thank you for your time. I really appreciate it.
Look, you're welcome, Thomas. It was my privilege to have had you take the time to want to talk to me and ask me those questions. And hopefully, people out there who are experiencing what it is that we've been sharing this evening will make their experience a journey. And for some, it can be a wonderful journey of learning, because many people can come through experiencing a serious illness. And when an event happens once, we call that an incident. And as Dr. Joe Dispenza talks about, when we have something that happens twice, well, that's a coincidence. And when something happens 3 or 4 times, then now we're looking at something that's trending towards something. And we're all miracles in of ourselves, and we all hear of miracles and spontaneous remissions from serious illness. We just need to look carefully at the research and the science that's coming out to support what it is that these people do to be able to achieve that. And there are a number of things that they put into place. And I know from my experience that those people that do the work, they get really good results. Whether or not that's a full recovery, if it's not a full recovery, as Robert says, none of us get out alive. they still have a quality of life. And that's really important, the quality of life and the time that they have. And I just can't reiterate that to anybody that's watching this and hearing those words, that there's always hope. And it's okay to hold on to that and just simply enjoy the journey that you're experiencing and embrace it. Don't fight it. Fighting anything always creates a loss. Because if there's a winner or a victor, there's a loser. And oftentimes it can be us. So work with things. Allow your body to do what it does naturally. Look for the underlying emotional components to it. Do everything else, but don't ignore that. Because it's such an integral part of what's going on, and what's been going on inside as to what's been happening outside externally in your life is just a reflection of what's happening internally. So we say what's happening in here is happening out there, and what's happening out there is happening in here. So we just need to look at those facets, but it's a part of the picture that so many people don't look at. They're too busy looking outside of themselves for the solution in relationship to this problem. Take this, do that, take that, drink that, swallow this, have that. And I just want to finish this off with, these are life-threatening illnesses. And to me, the word life simply means, if we break that down and we look at the letter L, which could mean look, the word I, which means inside, the word F, which means for, the E means everything. So life, look inside for everything. So don't miss that part. Look inside as well as going outside. Yes, do the nutrition, practice the meditation, do the yoga, practice deep breathing, mindfulness, have some fresh air, go into nature, but don't forget to look inside, because your greatest healing comes from inside. Anything that's labeled as being incurable, I often will say is, well, that's great, because it means that it's curable from within.
Yeah, so that's a good point. Right.
So a doctor may say, well, your disease is incurable, and the person says, well, they told me it's incurable. And I say, great, that means it's curable from within. Let's go within. Let's go inside and look and do the work. Release the energy. Energy tapping techniques, brilliant. Brilliant. But I don't believe standalone. But such a big part of it. So thanks for the time today, Thomas.
Thanks for your time too.